Hi, I'm Dr. Thomas McGinn, the Executive Vice President for the Physician Enterprise here at CommonSpirit Health. Today is Monday, March 21st, and welcome to the 5-Minute Check-In. As always, we will review what's happening with COVID across the United States, and here at CommonSpirit, we'll take a look at some new publications on the use of pulmonary rehab in recovery from COVID-19, and then we'll take a look at a non-COVID publication in the New England Journal of Medicine, a provocative article that looks at the use of CT angiogram for the diagnosis of coronary artery disease. It could be a real game changer. And finally, we're going to celebrate some great news coming out of our divisions. So let's get started. So as in prior episodes, we see that cases, hospitalizations, and mortality across the United States and here at CommonSpirit are down. Although it is humbling to see that we're still at about 1,000 deaths per day. That number should drop over the next few months. While this is good news and it's exciting times for us, particularly at springtime, we need to be careful. We're not out of the woods completely. If you look over at Asia and Europe, we're seeing an uptick in cases, we're seeing an uptick in hospitalizations. And here in the United States, some reports that up to 25% of the new cases are of the new variant BA2, Omicron BA2. Now, this does seem to spread a little bit quicker, but it is no more severe than Omicron, and we do get protection from the vaccine. So in terms of boosters, both Moderna and Pfizer are looking for authorization to give a second booster shot. Moderna for all adults and Pfizer for those over 65. I think this makes good sense, particularly as we approach the fall, and we might see a waning in immunity among the adults that we have. And other countries, such as Chile and Denmark, are already giving out a fourth booster shot. So as clinicians, there's a few key takeaways as we look at what's happening across the United States and across the globe. One, for those patients who have not yet vaccinated at all, we need to continue to encourage them to get vaccinated. And two, for those who have been vaccinated and eligible for a booster, we need to encourage them to get that first booster. Only 44% of eligible patients have received the booster. And three, we need to wait and hear what's going to happen about the recommendation for a second booster and make sure we encourage our patients to do that. And finally, fall is just around the corner. And yes, we have to start thinking about flu vaccinations. So in COVID-related publications, there were 2 meta-analyses published related to pulmonary rehab and the management of post-acute COVID. Post-acute COVID is 3 to 4 weeks after the acute infection where there are lingering symptoms. And these meta-analyses demonstrated that pulmonary rehab was beneficial, but they did state that the evidence was weak and that more research is needed. What's sort of interesting that's happening now is we're seeing more systematic reviews and meta-analyses. Looking back over these last 2 years of COVID-related research, where hundreds of publications were occurring that were small and of questionable quality. So a systematic review or meta-analysis will look over those publications, pick out the ones that are high quality, and summarize those for the clinicians. So out of the dozens of publications related to pulmonary rehab and COVID, one article looked at 6 and the other looked at 3. They were small studies, high quality, but only one randomized controlled trial. But they all did show benefit in 6-minute walk test, in quality, and in anxiety reduction. So it does appear to be beneficial, but more research is needed. In non-COVID related research, there was a major publication in the New England Journal. Fascinating article, really looking at the approach to the diagnostic workup and treatment of patients with chest pain with an intermediate risk for coronary artery disease. In one approach, CT angio is performed first. In the other approach, an angiogram is performed first. This study was done on 26 countries in Eastern and Western Europe and in over 3,500 patients, and basically showed no difference in terms of mortality or morbidity between these two groups, which really means we could approach patients with chest pain with CT angio first. This is very provocative and could be very beneficial to patients in a less invasive way for a diagnostic workup. But we'll have to discuss this more, perhaps on our next 5-minute check-in or grand rounds. And now for some congratulations. First, to the team in Northridge, California, who just celebrated a grand opening for their new urgent care location. And second, congratulations to Medical Safe Haven team for being awarded an $800,000 federal grant to expand to 3 more sites at residency programs in Santa Maria, Merced, and San Francisco. CommonSpirit Health is a national leader in response to human trafficking, and this grant will allow us to serve hundreds of additional victims of trafficking, providing them with specialized trauma-informed care and healing. So thank you for joining me, and I'll see you in 2 weeks at the next 5-minute check-in, where we'll be discussing asthma therapy and health equity.